Thank you. Part of the snow, we're in Minnesota, but there is snow for us. Thank you so much for being here. As you know, the Minnesota Public Health Association was established in 1907. It is a volunteer-driven organization representing a broad spectrum of community and health professionals on behalf of the public. I'm not a public health nurse, but I have always been well embraced by the public health community, and I'm very grateful for that. So thank you so much. This is the next to the last breakfast session, and the policy forum. Try to read from my notes here. With new recommendations about preventative care services such as mammogram, prostate exams, colon cancer screening. What's the middle-aged adult supposed to do? Even recommendations about how much water to drink and how much exercise is enough are always changing. What's new, what's being reinterpreted, and what's staying the same will be discussed at this forum. Thank you so much for being here. We have our moderator, Paul Terry, and I was interested in seeing that you were at the Park Nicollet Institute, Park Nicollet Health, raised my two sons, so I'm very grateful. Paul Terry is a senior fellow at HERO, Health Enhancement Research Organization, where he collaborates with HERO members and national experts in planning learning events and supports the HERO team in organizing an annual forum, think tanks, and webinars. Before HERO, Terry was president and CEO at Stay Well Health Management, and before Stay Well, Paul served as president and CEO of the Park Nicollet Institute. He earned his PhD from the University of Minnesota and his master's from the Minnesota State University at Mankato, where he was honored with the Distinguished Alumni Humanitarian Award. Terry is a past president of the Minnesota Public Health Association. He serves on advisory councils for the National Academy of Sciences, the American Heart Association, the Harvard T.H. Chan School of Public Health, and the University of North Carolina, Gilliam School of Global Public Health. Prevention programs that Terry developed won the C. Everett Koop National Health Award. Alongside his wife, Gail, and his children, Anna and Will, Paul loves rowing, windsurfing, sailing, kayaking, camping, hiking, biking, and cross-country skiing. Paul, thank you very much for being here this morning.
Thank you very much for that, Antonio, that you gave us so much information about me. I hope people understood that the main recognition that I have over the years is your job as past president of Minnesota Public Health Association. I can assure you there are several past presidents here. It'll stay with you as one of the best things you ever did was getting involved with MPHA. So that's the distinction I really bring. Another distinction is I get to introduce our two panelists today, Chris Haugen and Mandy Winarka. As much as we're going to be the conversation starters today with this small intimate group, I would urge you to consider this a conversation among all of us. And I can assure you already with Mandy and Chris that we can carry on a pretty stimulating discussion all by ourselves. Don't let us do that, because we really want to take advantage of this small group to make sure you engage with us. Chris Haugen, she's with the Minnesota Department of Health in the Total Worker Health Program. She's a workplace well-being specialist, but she's also a leader in the Office of Statewide Health Improvement. We call that the SHIP program. I've written in the Journal of Health Promotion about how our state is unique, I think, in many respects around the nation because of our investment in many years now in SHIP. In the very rare occasions I get asked my opinion about what we should do with our careers, I refer to people like Chris. Chris has got such an interesting background in that she's in pretty much every sector that a public health worker can be in. She's been in the private sector, the public sector, the healthcare sector. You've been at Red Brick, you've been a health coach, you've been at General Mills, she's been at Wells Fargo, so she's been in agriculture, she's been in finance, she's been in manufacturing, and now she, the founders of this country said, at some point, you private sector people, you've got to go pitch in the public sector. So good for you. You're doing exactly what people in our line of work are doing. And like me, biker, kayaker, so you're in good hands with Chris. Mandy Winarka has a really impressive background. She's with Mindful Wellbeing. You are a licensed clinical social worker. Talk about doing God's work. She's certified in perinatal mental health specialization, practicing psychotherapist. Before that, she's been an approved consultant for trauma-informed therapies. We're going to talk a fair amount about that, I predict, especially in terms of reproductive health traumas is one of her areas of expertise. You're a proud graduate of University of St. Thomas, St. Catherine's University, and she's worked in both individual and family therapy. But again, by way of preview, she's very broadly gauged. So bring it on. Mental health is going to be one of those questions we ask ourselves about a fair amount. And so you've got free expertise, free resource here, so you should really tap into her. We're each going to start with just some brief comments, and I'm going to chat with them a little bit about questions that the planning committee brought forward. And then the main course is we're going to ask you guys to chat together, generate some questions and thoughts of your own, and then we'll field those as well. But again, small group, jump in anytime. We're really eager for your questions and comments throughout. Just a quick thanks. You can't hear me, but Angie, we're so grateful for Angie Carlson. She was Metro Traffic Control getting us all here. She's just amazing. Kathy Norlene, thank you for all the organizing work. Antonio, thank you. And then, of course, the rest of the planning committee. Thank you guys for getting together. With that, Chris, I'm going to have you get started with just some opening comments. What's new? What's trending? What's mythical? What's tried and true?
Thanks so much. I just want you to know that I seem to follow Paul around. He hired me first as a Stay Well health coach.
Don't say it. Don't say it. How long
yeah. Well, I will, because it's pretty interesting. It was about 38 years ago. Yeah, it's amazing. And then we showed up together at Park and Play. So, and then probably a couple stints at Stay Well and Health Management as well. So, I've called on and off for quite a while. And he is a thought leader, and he has inspired me to be a thought leader, thinking about what things are going on around, what do I see. Workplace wellness has been my passion for many, many years. And certainly it's been an interesting thing to think pandemic, because I would say that was really a huge watershed moment. And I was actually pretty excited about public health when 100-year pandemic happened, because it was really helpful for me to really understand the importance of public health at that moment. From a workplace perspective, it was all hands on deck to learn how to do virtual, to try and support people, our local public health partners in SHIP. I work with 41 different health boards, probably 200 to 300 people across the state. And they were saying, what do we do? I know I've got my organizations asking, what do I do about this? What do I do about that? And, you know, yesterday I was reflecting with a group in a meeting about how we could only do as much as we could in the moment because we didn't know anymore. You know, we knew 6 feet away was the first issue, and we knew that that might be airborne, so we need to think about that. Then we knew that there was a vaccine coming down along the way, and you know, and so all those different pieces helped us learn a little bit more, but we never were able to see the whole front, right? So talk about trauma informed, and Mandy and I had some conversation about that. I think from a workplace perspective, we have just seen just a major shift in how people do work. Along with that, then Gallup polls started putting out all kinds of information about what do workers need, how can we support our workers, and we spent a lot of time talking about how you keep people connected, especially when we went into isolation for that 6 or 8 weeks, and how we could really support people. And so, I really think a lot about the workplace as working age, middle-aged folks, and it was a major life crisis for many people. Another part of my job is in the last 3 or 4 years, I've really started looking more at community well-being and what does community look like. And so I'm leading efforts in well-being for SHIP. And I will tell you, it's a little bit vague, but there's a lot more information coming out about how you can have community supports around social connection, around being trauma informed. And the place where I really see a lot of problems and concerns is that we don't have a social safety net for mental health. And we have a lot of good information about how you do prevention in that mental health space, but we don't have a lot of good indicators or resources about how do you create a safety net within your communities. And I work with small communities, and so we're really trying to forge. I feel like a little bit of a wilderness right now. How do we help people create those systems to be able to be connected, to be able to have people in those spaces, to take care of themselves, to build that resilience. So those are kind of my 2 perspectives that I bring to the table. And always looking for new ideas. So happy to engage with you often.
Chris, I was a planner last night and wrote out all of my remarks. So I'll be doing a little bit more reading than Chris just did off the cuff, but hopefully you'll be okay with indulging me a little bit. As I was preparing some of my remarks, I was feeling a little bit intimidated by this concept because I'm not in the medical community in the same way. I have an interest in public health. I've flirted with that. I've flirted with a lot of medical pieces as well, but ultimately being in the seat of a mental health worker, I thought, who am I to sit up here and talk about, how much water we're supposed to be drinking and things like that. And then it occurred to me that I am also a middle-aged person. And so my remarks today reflect not only my professional experiences, but also my personal ones. And you're going to hear that a little bit. So I'm going to start off with, something you all probably encountered someone in your life with a similar story. I diagnosed myself with ADHD through TikTok in 2022. And as a mental health professional, with a guilty pleasure for admittedly a little too much social media, I recognize that might not have been the best course of action, but I think it actually highlights a lot of what we might talk about today about how to access and support for folks. After the diagnosis was officially confirmed through all the regular means of testing and all of those things, I went through an internal reckoning, a reckoning with myself about the diagnosis and what that said about me, about the feelings I had about not being diagnosed sooner, the relief when the first day of medication, I experienced like true silence in my brain. Cannot tell you what that was like. Shortly thereafter, I lost my best friend to alcohol use that he had hidden from. And grief took the literal and figurative breath from me, just as I was starting to feel like hopeful for some sort of different new phase. And as I've been working towards setting new goals, I've been looking at the world differently. I've been trying to create something I call holiday church elbow room as a way to move through my life with less masking, and more room for creative expression, softer self-imposed deadlines, and a gentler gaze towards myself. For those who don't know exactly what I mean by holiday church elbow room, let me explain. For much of my childhood, we were a church-going family, and inevitably on holidays, folks would just kind of pile into the church, right? The attendance would swell, and in the very long church pews, the ushers would come and jam more and more people in there. Children in particular seemed to be the targets for getting the extra room kind of squished out, and you ended up being, next to people in very close proximity. One day, my dad coached us on a technique to try to save ourselves just a little bit of room. He said when we sat down in the pews, we should rigidly hold our elbows out to the side and create some space. And, it was a pretty effective but simple technique to just get a little bit of breathing room. And so nowadays, I actually tell my clients that story because I'm encouraging them to think about how do you create holiday church elbow room in your life. And that's kind of what I think we are looking to do with some of our discussion. We know that there are folks like Eric Erickson who created classifications for different developmental stages, including the middle adulthood crisis that he called generativity versus stagnation and self-absorption. He believed that in midlife, adults were focused on existential questions, including the impact we may end up leaving on this earth, how we would be remembered, if we have found meaning in our life's work, though not necessarily through our career, and evaluating our connection with others. Nearly half of the midlife population is a part of the sandwich generation, folks who are simultaneously being pulled towards parenting their own children, who are sometimes infants and sometimes launching into adulthood, while also assisting with aging parent needs. We are also expected to have enough time left to invest in our own health and well-being. It's truly a balancing act like no other time in our lives. Despite being one of the largest age clusters for the human lifespan, which is sometimes defined as a 20-year lifespan and in some definitions up to 40 years of time, the midlife stage has some of the leanest research available on development in this time. It's almost like all of us midlifers are just too busy balancing all of the stages and demands of this stage to help contribute to the body of research. Speaking from a slightly more personal point of view, facing down what I call peri or perimenopause, as I've affectionately named this latest medical mystery, has been an extraordinary challenge for me. Somehow, the 8th grade sex-ed class either didn't cover, or much more likely I didn't really track what was going to be happening in this season. What's worse is that while adolescence and matrescence, which is one of my clinical specialties as a therapist, are pretty well covered by an abundance of educational content you can readily find, I've found perimenopause and menopause to be the Wild West of medical care. The strained medical system, which refers both to the physical infrastructure of clinics and offices, as well as the insurance companies that support that infrastructure, aren't built to comprehensively support my desire for holistic, empowered care that is affordable, accessible, and helps me figure out what the heck is going on in my body. Whether I'm dismissed for symptoms that I think have meaning, or I'm told you'll know when you get there, or invalidated for being curious or expressing a desire to be proactive, many of us midlifers are left to figure out our latest health ailments on our own. Personally and professionally, I don't anchor into the midlife crisis mantra. I do admit I've been turning towards some more homesteading activities as of late. I make a really mean kombucha. And, I can, bake some sourdough, and I'm working on homemade yogurt. I don't do those things as some sort of frantic cry for help or search for life's meaning. Rather, I'm proactively taking care to cultivate opportunities to learn new skills, establish new habits that might have health or wellness benefits for me and my family, and open up to some new experiences and opportunities besides my previous repertoire. So what's to be done about midlife through a mental health lens? Here are some of the trends I've seen and hope will continue to gain traction. Number 1, generational perspective shifts. A midlife population increasingly chooses to incorporate mental health into their vision of holistic wellness. For long, mental health was stigmatized, and I think we may finally be seeing some generational shifts in that regard. Folks are more willing to seek to understand the intimate intersectionality between medical and mental health, and of course, I'm totally here for that. Middle-aged folks are getting there together in ways that they aren't the same way their parents did. That is, they are returning to older, tried and true ways of moving through the world. They're increasingly trying to tune into their intuition, their innate inner knowing, and their inherent ability to problem solve, to create, to destroy, and to heal. They are rejecting expectations that this part of their life has no control, that they're simply expected to age and honor that aging and health in all facets. Excuse me. Number 2, folks are willing to tackle the same but arguably more complex challenges. As long as humanity has moved through the world from a place connected generation to generation, there have been folks that have been in this sandwich generation, and at baseline, it's no small feat to be in this role. But it's clear that the world has gotten more complex, and as we've extended our lifespan, and therefore the span or reach of middle adulthood, these demands have also increased in their complexity, complicated by the reduction in multifamily or multi-generational housing, increased societal demands for autonomy. The American way of life does not inherently extend assistance to those in middle adulthood. Rather, on top of the competing external demands for our time, this stage is further complicated by internal demands from our bodies that begin to experiencing aging with the onset of various health ailments, chronic health complaints, and normative, yet no less alarming developmental changes as the hormone changes come from menopause. Number 3, reinventing mental health tools with midlife in mind. While modalities focused on resolving trauma are paramount to remain accessible for those in middle age, I'm increasingly seeing a need for tools that are more about managing stress and overwhelm, while also carving out space for evaluating our expectations and course correcting for the years ahead. Mental health tools and resources need to be accessible and easy to use. Barriers need to be drastically reduced to increase engagement, implementation, and integration. This means getting creative about how people access the information in the first place. Hello TikTok, podcasts, graphic novels, apps, and more. Those in the mental health field have to be flexible with everything from days and times offering client appointments to fit life's demands, while also considering what frequencies are attainable and sustainable for clients. Clinically, a heavy focus on stress management or mitigation, mindfulness, unitasking, and challenging maladaptive coping and perfectionist tendencies are supremely important for those to support healing. Midlife clients are more often than not, compelled to unpack their own experiences of being parented and reconcile that with their challenges of parenting. Midlife clients are some of my favorite to work with. For me, the dark humor and realism within therapy sessions is a refreshing breath. There may be no better cherry on my day than a 40-something mom looking me dead in the eye and telling me they proudly posted a photo on social media of their messy AF house to help people understand that their life isn't perfect. So whether we're talking about pin keeping, empty nesting, boomerang kids, sandwich generation, or midlife crises, my hope is that we can focus on what it's like to live lives connected to our personal values while promoting an increase in healthy dependence and connection with one another as we move forward.
Great, and congrats to both of you for your thoughtful openings. As you can tell, there's lots to talk about, and I'll have a lot of questions for them. And again, I'm going to invite you to jump in and we'll have response groups. But I'm going to take the panel chair's prerogative and also throw in 5 more trends that I want us to talk about. Selfishly, I don't have answers to how these trends will pan out. But I love the wisdom behind the title of this panel, what's tried and true and what's new. The reason I love that title is because both are needing to coexist. What's tried and true is continuing to be best practices, if you will, in the public health field. And we rely on those best practices to try to make progress, and things that we've not made tremendous progress are, mental health being one that we've brought up quite often. But what's new tends to be that shiny object that always allures us and always tries to get our attention, maybe takes more than our attention away from what's tried and true. Let me give you an example. Let me give you a metaphor. For most of my life, I've been a windsurfer, really badass, high-speed windsurfer, but I also sail. If you're a windsurfer and I'm coming at you at 20 miles an hour and you're coming at me at 20 miles an hour, there are rules of the road. And the rules of the road is always know who's on your port side. The port side tack gives way. So if my position is I'm coming at you super fast, holding on to the sail, I'm leaning back, I'm getting speed, you're coming at me, and we're going to have a collision. And so I have to remember port side gives way, and so I'll fall off the wind. If you know the rules of the road, you're going to fall off the wind, and we'll just be fine together. Same if I'm overtaking you, those rules are similar. If I'm on the port side tack, overtaking you, I've got to give way. 40 years, I had that ingrained in my head, that port side tack gives way. Now, because of my age, frankly, I'm less of a badass windsurfer, and now I'm a rower. So on my water sport nowadays is rowing. If you guys know rowing, when I'm coming at you rowing, I look like this. And I could be getting a pretty good flip going, and I'm looking and I'm looking. And so the person in charge of the rowing, if he sees a collision about to occur, he also knows the rules of the road. He says hard on port. And hard on port means you have to pull hard on the port side. Now, where's port side, you guys? It's over here. And so I had at least 5 years, I'm still not over. I had 5 years when they say pull on port, I mentally have to turn around, pull port's over there. That means I pull on my right arm. I don't pull on my left arm, I pull on my right arm. So I would argue, hang on to that metaphor, that that's what's happening in public health education in many respects. Let me give you 5 examples. When I grew up in the field, especially relative to worksite wellness, there was this real preoccupation with your lifestyle. affects your health, and your health affects the work. And so we ought to get very active in helping people change their lifestyle, change their health behavior. Does that sound familiar? Does that feel like that's where the field's been? Well, turn around, because total worker health, the concept that Chris is an expert in, is what's trending in this field. And total worker health says it's the work that affects the health. If we want to be effective in public health, we have to change the work. We have to change the environment. We have to quit putting so much focus on the individual and their health behaviors and put more focus on the environment that shapes that behavior. So half of my days, I'm like, oh, wait a minute now. Did you watch Oprah the other day talk about GLPs, the new weight loss drugs, or have you been reading about this massive sea change that's happening in the nation relative to the possibility that used to be a diabetes drug will increasingly be used for obesity? What was the main, anyone who watched Oprah or that thing, what was the main message? The disease is not your fault. It's the disease, it's not your fault. Now, wait a minute. I've been on Portside Tack for 40 years of nutrition science and behavior science that seems to suggest that the choices we make, the individual choices we make in exercise and in nutrition, have a lot to do with our health outcomes. A lot to do with whether or not we're going to be managing obesity. So Oprah says, wait a minute, turn around. This is a disease. And so if we have a medication that can help this disease, a big change, a big sea change, I would argue, in our field, and we're doing a think tank on this coming up this fall, is how do you reconcile lifestyle medicine, a whole discipline still dedicated to plant-based foods, eating right, being physically active, wishing the medical community was more proactive in lifestyle counseling. How do you reconcile a drug against that? What's that gonna look like in our future? So that's two. Total worker health, turn around, fields turn around. When I started in this field, number 3 trend, we used to be quite preoccupied with medical data, as I was talking with you about, healthcare claims data, with epidemiology, that had to do with, are we reducing the health risk audaciously enough, even at the population level? Can we actually reduce the health risk, not just of one volunteer who's showed up for counseling? Could we change the health outcomes of a whole population? Pretty darn audacious. Our field, in my view, of the late has gotten so darn ambitious that we're not even satisfied with reduced health risk or reduced health costs. We're talking increasingly about mindfulness. Should the whole population be more meditative, more accepting, more purpose-driven? And we're talking audaciously enough about thriving. Could an organization actually have a goal that relates to increasing the thriving of the whole community or the whole population? And the question I keep asking, as someone who used to sail this way, not this way, is the speed at which we can make change? What is the sphere of our influence, essentially? If I'm a CEO of an organization, should I have thriving as one of my goals? Or should I have health risk reduction as one of my goals? Or how do you reconcile those? So that's a question I don't have the answer to. 2 more quick ones, and then we're going to start chatting together. I love the body acceptance movement. I love the fact that people are saying quite clearly and regularly, body shaming is work, fat shaming. Yeah. But, and so the language I'm hearing more and more is what's often referred to as first person addressing health issues. So for many years we've said you're not a diabetic, you're a person living with diabetes. And now I'm increasingly hearing that with respect to our weight and our body issues. You're not an obese person, you're someone living with obesity. The question that I'll have for this panel and you all that we need to reconcile is we still have words that we still need to use to help explain what's going on biomedically and physically with a community or with a person. And so to what extent is there tension now? I had the earlier phobia movement and the lifestyle change movement in terms of environment. The word that we're using as clinicians, for example, to continue to define our job and know if we're making progress or not. And then finally, maybe this is selfishly, as someone who's going to turn 70 this year, One of the think tanks which we just did was called Brain Health and the Aging Work. Brain Health. It's not, when I picked that topic, 8 months ago, I thought, I wonder if this is a stretch goal for employers to talk about their role in brain health. But then, of course, Trump and Biden started campaigning, and they were forgetting pretty much everybody they wanted to talk about. And so now brain health is top of mind throughout the nation, and everyone's saying, should we be brain health testing? Not just our political leaders with their thumb on the nuclear button, but surgeons, should they be brain health tested? Health educators, should we be brain health tested? So brain health, I think, is trending as something that is going to continue to command our attention. But again, back to the title. None of those 5 things that I named and none of the other issues that our colleagues are going to talk about replace what's tried and true. We still know what best practices look like in terms of trying to have a healthier environment. Those are still in play. These are all things that we also have to do. So I'm going to chat a little bit up here. Jump in anytime with your questions. Just shout out. If I'm not seeing a hand go out, just shout out, because this group is small enough. I'm not worried about chaos. Not worried about disorderly. If it was a pay for 1,000 people, I'd say, hold your questions. We're going to take them. There's 15 of you. Jump in anytime you want. So, when I read your bio, Chris, I was so interested at this migration you've had in your work life from the whole worker health expertise to thriving communities, back to stretch goals for our profession. How is it that we can even presume that when it's so difficult just at an organizational level to move that size population? Talk to us a little bit about how you can be so audacious to say you're going to actually get a community to thrive.
Organizations are a microcosm of the larger community. And so what's beautiful about organizational health and wellness is that you spend 8 hours a day there. Everything can be impacted in ways from, movement time to the food that you eat. And so it makes a lot of sense. But when we start kind of looking at the rippling circles that go out, we know that not everybody has the same activities, the same ability to do the things that people in some organizations do. As well, organizations are also really unaware of what happens in people's homes. And I think, again, the pandemic brought that out a lot with food insecurity issues and with how tenuous people's savings are. You can lose a job and you can be homeless within 3 months. You're just living paycheck to paycheck. So I really started to look at bigger models, community-based models, about how you can create a model that actually takes into account kind of a caring community standpoint, and looking at all the different systems that allow people to be able to be food secure, what you can do in housing as it relates to making sure that people have housing to begin with, as well as have affordable housing and be able to maintain housing and have safety nets in the case that you lose your housing. Been thinking about transportation systems. SHIP does a ton of work around active transportation, biking, walking, working with buses, making sure that people who are on the lower income scale, who don't often have the ability to own cars, are able to get around and be able to move. I spent a lot of time learning about redlining and how the Twin Cities really wrote in a lot of racial covenants in their housing. My neighborhood, unfortunately, was one of the first ones. It was hard for me to think about how there was a vibrant African American community on the south side of Lake Area in the early 1900s and was dispersed in a matter of 30 years by redlining. So you start to think about sort of the social constructs that we've had around kind of marginalizing where people live, and then they are not bus lines, they are not able to have affordable food because they're probably buying from Tom Thumbs and Super Americas and all those things. And you start to think, if a community really could embrace what it means to look at what they offer their communities as a whole, it makes sense. I work with a lot of small and large communities across the state with SHIP. I talk to people in Melbourne. I talk to people in Fergus Falls. I talk to people in really small towns like Graceville, right on the edge of South Dakota border. And we have 2 counties that don't have any hospital systems within their counties. And that's really crazy. Minnesota. I listened to the state demographer talk about the way that that people are moving and trending in the state. We're losing a lot of people on the agricultural side. A lot of people are going to the Central Lakes. You look at the Central Lakes where people are retiring to their cabin homes. We have a shortage of dentists and doctors. I mean, so you're looking at this from a bigger, larger planning process. And so I'm really trying to urge our local public health partners to be the public health consultants in their communities so that they can look at all these different factors and figure out what does this community need to thrive.
And one of the overlaps when we were prepping for the panel between you and Chris related to mental health, Chris naming mental health first aid is something that she's been an advocate for. We know in your field that there's a crazy shortage of mental health specialists. And so one of the things that gets talked about a lot is, what's the role of the supervisor? What's the role of the EAP? How do you end up essentially having these non-experts play a role in supporting the mental health of the population? Can you talk a little bit about it? Because I asked this because you're so deeply credentialed. You went and made sure you got certification on all the areas you were interested in. But we looked at people, garden variety supervisors, to try to recognize mental health issues and be good about referring. Can you talk about the upside and the downside of that? It's got to be a shadow.
Yeah, I mean, I think that the upside is that when folks are supporting workers or, management or supervisors are engaging in that, they're normalizing that mental health in particular is something that is part of a holistic view of who you are, and honoring that everyone's mental health is impacted on every single day, and it varies every single day. So to me, the upside is that there's some transparency and potentially a little bit of authenticity in being able to have those dialogues and discussions. I think that the downside or the shadow side comes into play if you have folks who aren't trained in some of those like first aid, mental health first aid kind of components, or the QPR protocols, things like that, where they're going to ask a question, they're going to lift up a comment, and then if there's something comes back that is at a high level of distress or reverberation of mental health crisis, they may put themselves in a circumstance where they won't know what to do next. It reminds me a little bit of the discussions that used to occur about physicians not wanting to give mental health assessments like PHQ-9s, assessing for depression or anxiety, because they were so worried, like, what happens if there's a positive score? And, I wouldn't say that that's completely resolved. We still have some challenges with that. But part of the crux of supporting physicians in encouraging that was saying, like, look, you have this touch point that other people won't have, this opportunity. And we can support you as mental health professionals in, administering this assessment, but also in what to do in a crisis, what to do, who to call, those pieces. So I think that, the task is to make sure that medical professionals in that regard, or in this example, employers, have access to the appropriate trainings and that kind of thing to support their team, and that there's a conversation and dialogue going between those roles and mental health professionals in the community, so that there is a real-time ability to respond to a positive, yes, actually I am struggling, because I think otherwise you're going to create a different issue if you don't proactively plan for those kinds of things.
So we have a bunch of questions that came from the committee as they were preparing this as well, and I'm going to tee up this first one, and we're going to go to small groups. So at small groups, this is the same question we're going to start with for you as well, and I'm going to give you an assignment to decide this question, but they are right on theme here. And Manuel, would stay with you on this one because you brought up the sandwich your opening remark. The committee is saying, when you think about these middle years of sandwich years, work, caregiving, family issues, alongside caring with your own individual health, the committee was wondering if we could talk a little bit about what positive changes we're seeing in the workforce relative to how people are managing changes. But also reflect a little bit, especially post-COVID, what are some of the challenges of this negative?
I think for the positive things that we're seeing from folks it's more of like an empowered stance. I feel like I see folks moving through some of these conversations and top points with not only do I support folks individually, but as a small business owner, I employ folks. And so we kind of fit into this little microcosm, a very small microcosm of as well. And I just had someone this week who we had a meeting, and it was a semi-important thing that we were going to try to hash out some things behind the scenes with some billing shenanigans, right? And she contacted me about 10 minutes before the meeting and said, I can't make it. I've got to go to a discharge planning appointment for my mom, who's in going to go to a rehab center. And she's like, I'm so sorry. They just planted that on me, literally 30 seconds ago. And I was like, you got to go do that thing, right? She's navigating, parenting and supporting her mom. And that was the answer. There was no other answer. There was no I'm sorry, this has to be a priority. You have to tell them to, reschedule. I think that increasingly folks are asking the question or stating their truth and saying I need some help or support with that. And I think that's great. I think we have to start there. We have to start looking at what people's lives are needing. And as employers and people supporting employment, we just have to look at where is their flexibility and where is their rigidity, and different industries have different standards for that. I feel like everyone is kind of coming out of the COVID fog of things, and I was saying to these guys, before we started, that my perception was about 6 months ago, we were in that narrative of, okay, we're coming out of the fog, but I feel like it was kind of like a false one, kind of like we talked about our false spring, where it felt like really what we talked about 6 months ago was everybody kind of trying to go back to normal pre-COVID, and then everyone discovering that normal is a construct and also normal doesn't exist, but also pre-COVID was chaotic and frenetic, and there were a lot of demands. And so I think that what we're seeing now is people trying to make different choices, but that being very hard because we're trying to reverse engineer our lives with different ideals and different pieces, but we don't necessarily have the social structure to do that, right? The landscape hasn't changed, but people's internal experiences and desires have. And so we're going through, I think, a reckoning with trying to figure out what does that look like post-COVID.
I love that idea. We are re-engineering, but we don't have all the tools. And we have a new awareness, but we just don't have the other pieces that are fitting in with that. And so I think the positive changes that I've seen is that people have a deeper understanding of self and what's really important. And I think that's really a driving thing, especially when you are an adult and you've been programmed one way, and then you get this approach in life, and you have to figure out new ways of doing things. So I think that's really a positive thing. But what I see is lagging behind is we had an issue with social isolation before COVID started. That was the big news that fall in 2019. And I was already trying to figure out how to address it. And then boom, we get slammed with the pandemic. And oh my God, what happened to all that discussion that we were starting to have? And so I really feel like that we also are missing an opportunity to heal and really process that. It's like, whoop, back to normal, here we go. Definitely, I hear the public health world. I need to process some of this stuff and figure out, what does this mean for me personally? What does it mean for our organization? MDH, and I will be very honest, we were in a crisis mode. I didn't do my normal job for about 10 months. And luckily I had an easy job, which was actually very invigorating, while my coworker was working out of class, working many hours a day trying to stand up vaccination clinics across the state, which was not in her specialty. And so, I see my colleagues who had some of those difficult situations trying to come back to the work, and they're burned out, frankly. And it's just really tough to see that. So I'd like to see more room for healing. The other thing that I think is something that we need to talk about that isn't COVID dependent, and that is workload. I have seen workload increase over time. In fact, the other day I thought, how many emails did I write today? I look back, I wrote 46 emails. that's insane, right? Now then I was going back to 1992 when I was working for the state of Washington. We didn't have email. I would probably make 5 to 7 phone calls. I would wait for some people to call back. I would do it. And I thought, oh my gosh, how can my brain cope with this? So for you younger folks coming up, this workload issue has to be addressed. And we bring some trauma-informed trainings within our whole MDH unit. And we are talking workload. We are saying this is untenable to be able to keep up. And how do we space things out? How do we figure out how to make life more manageable? And that's at work. So then we think about home, and you think about multiple kids, and you think about running them to different activities, and you think about, I just watched some of my friends who have kids in sports. Luckily, my child was not a sport guy. They're running with it. They spend all their evenings as a taxi cab. So.
Okay, you guys, we're gonna do group work now for the rest of our time together. I'm gonna suggest a couple of you move and make sure that each table has at least 4 at the table. I'm gonna invite you guys to come and